What is nondisjunction? Nondisjunction is a failure of the segregation of chromosomes or chromatids during cell division, resulting in aneuploidy. Aneuploidy is extra or missing chromosomes. Nondisjunction can happen in anaphase of mitosis, anaphase 1 of meiosis, or anaphase 2 of meiosis. To understand nondisjunction, we need to understand the mechanism with simplified cells. Let's start with this as the original parent cell. This is a simplified animation of normal meiotic division. What gametes does this produce? Normal meiotic division produces 4 N gametes. These are half of the ploidy of the original parent cell. Now that we know that a 2N parent cell should produce N gametes, how does meiotic nondisjunction happen?
When nondisjunction occurs in meiosis I, there are a range of different gametes that may be generated. Normal gamete has 2 chromosomes per cell. Here we have N+1, which is 3 chromosomes, and N-1, which is 1 chromosome, making no normal gametes. The failure of segregation in meiosis I is caused by a failure of the homologous chromosomes to separate in anaphase I, leading to abnormal gametes. Nondisjunction can also occur in meiosis II. Unlike in meiosis I, there is a chance of creating 50% normal gametes with N chromosomes being 2. There is also a chance to create N+1 and N-1. In meiosis II, the failure of segregation is caused by a failure of the sister chromatids to separate in anaphase II. When nondisjunction occurs during mitosis or cellular replication, this can cause somatic mosaicism, which only affects the direct descendants of the original cell. This can lead to cancer. When nondisjunction occurs in meiosis, there are typically more serious clinical disorders associated with this mutation. Most aneuploidies, or difference in number of chromosomes, cause death, but in some aneuploidies, including Trisomy 21 or Down syndrome, there is the possibility to produce viable offspring. Some examples of autosomal trisomies include Powtoons syndrome, Edwards syndrome, and Down syndrome. Examples of sex chromosome aneuploidy include Klinefelter syndrome in males, XXX syndrome in females, XYY syndrome in males, and Turner syndrome in females.
Trisomy 21, or Down syndrome, is an autosomal trisomy. It's the most common viable aneuploidy and is characterized by 3 copies of chromosome 21. Down syndrome occurs in 1 in 700 births. People with Down syndrome display physical abnormalities and intellectual disabilities. The average lifespan of someone with Down syndrome is 60 years, with an increased risk of dementia and other health problems.
Monosomy X, or Turner syndrome, is a sex chromosome monosomy that occurs in females when an X chromosome or part of an X chromosome is lost. This condition is only seen in females, as if a male were to lose an X chromosome, they would not be viable. Turner syndrome occurs in approximately 1 in 2,500 births. The main symptom is a short stature. Other characteristics include heart problems, short neck, infertility, and nail dysplasia. High mortality rate is due to the higher incidence of cardiovascular and autoimmune diseases. Females typically have 2 X chromosomes. This leads to the need of dosage compensation where one of the X chromosomes is randomly silenced by methylation. Still, some genes on the methylated chromosome are able to escape silencing when they are needed from both chromosomes. When patients are missing the second X chromosome, they lose the genes that are unsilenced, which lead to developmental abnormalities.
Now that we know more about disorders caused by nondisjunction, what puts people at an increased risk? There is a strong correlation between parent age and the chance for chromosomal abnormalities. These 2 graphs illustrate the correlation between maternal age and nondisjunction events. Females are born with all of their eggs, unlike males who continuously produce sperm throughout their life.
We now know that there is an increased risk of chromosomal abnormalities as maternal age increases, but how do we test for these? To test for abnormalities, we can perform cytogenic analysis of fetal cells in utero. In utero testing is amniocentesis or chorionic villus sampling. Prenatal screening tests exist to help provide new parents with an age-adjusted risk of fetal chromosomal aneuploidy. Safer testing has been developed to be able to test the fetal DNA in a simple blood test of the mother.
Chromosomal disorders affect the lives of many people around the world, and an average of 4 per 1,000 births worldwide. While there are complications caused by chromosomal aneuploidies, the improvement of things like medical care, special education, physical, speech, and occupational therapies have all increased the longevity and quality of life for people affected with these conditions. Thank you all for listening today. Happy learning!